Okay, guys, Texas Center for Proton Therapy works daily to offer hope to every patient who walks through that door. That includes breast cancer patients. In light of Breast Cancer Awareness Month, Paige went there to find out more.
October is Breast Cancer Awareness Month, and women need to be aware of the risk factors and the treatment options for breast cancer. I'm excited to introduce you to Dr. Jared Sturgeon. He's a radiation oncologist for the Texas Center for Proton Therapy. Good morning to you.
Good morning.
Let's talk about risk factors and symptoms that women need to be aware of with regards to breast cancer.
Well, the biggest risk factor for breast cancer is just getting older. Family history can also play a role. And then women should look for changes to their breast, tenderness, new masses, swelling, changes to their skin, and if they're concerned, get those evaluated.
What is proton therapy, and why is it beneficial for women who have been diagnosed with breast cancer?
Proton therapy is a highly targeted form of radiation. It uses protons which are accelerated by a 220-ton cyclotron to nearly the speed of light. This allows for proton therapy to be much more precise in the way it is targeted. The beams stop, and this allows us to aim at what we're trying to get to and miss the healthy tissue we want to avoid.
Is any woman with a breast cancer diagnosis, are they a candidate for proton therapy?
Well, because proton therapy really is designed to reduce the radiation to the heart and lungs, younger women are always candidates for proton therapy, and so are women who have node-positive breast cancer and women who have heart and lung disease.
What if women have been diagnosed with breast cancer and have already undergone more traditional radiation treatments for breast cancer? Would they still be eligible for proton therapy?
It depends on the situation. If they have their cancer come back or have a different cancer, they may be. Proton therapy is often used in situations in which we have already had radiation or some other issue. One of the primary uses of proton therapy is just reducing the amount of radiation a woman receives. And so we often use proton therapy in children, in brain cancers, like we're talking about breast, lung, and prostate cancer for those reasons.
Does proton therapy have less negative side effects than traditional radiation treatments?
In breast cancer patients, the goal really is to reduce the heart and lung side effects. And so in that regard, proton therapy reduces the radiation dose to the heart and lungs significantly, which can lead to reductions long-term in those women having problems.
How does a patient schedule an appointment with Texas Center for Proton Therapy?
Patients can reach out to us directly, or they can have a member of their cancer team contact us. We have specialists who are experts in getting all of their information together so that when they meet with me, they can have a conversation about whether protons is right for them. For those in North Texas, we're right in their backyard, just north of Dallas, but we also have the ability to schedule telemedicine appointments.
Well, thank you so much for sharing with us this important alternative for traditional radiation treatments through Texas Center for Proton Therapy. I appreciate it.
Thank you very much.
Texas Center for Proton Therapy is on West Royal Lane in Irving. Call 469-513-5500 or go to texascenterforprotontherapy.com for more information.